and thank you for joining us for this fifth installment of the 2025 HealthLinks webinar series. It is September 17th. It is Recovery Month, National Recovery Month. September is Recovery Month each year in the US. And we're really honored and grateful and excited to have this conversation about recovery-friendly workplaces, specifically in healthcare. We've had a conversation about recovery-friendly workplace in either late August or early September for the last 6 years now, and we're really, again, grateful and honored that we get to do it again this year. So thank you. Welcome into this space. For those of you that are familiar with our webinar drill, we ask you to use the chat function to tell us where you're joining us from. We'd love to see all the states and various countries around the world that are participating in today's webinar. So just a few housekeeping items. We do keep all participants on mute throughout the duration of today's presentation. You can use the chat like you're doing right now to tell us where you're from. And also, if you have any technical assistance questions, we have team members standing by and ready to help you troubleshoot if you're having any issues with Zoom. Give us a little bit of grace and patience with responding to those questions because there's a lot going on in the chat right now. If you have questions, though, as things come up throughout this hour of presentation, we want you to use the Q&A bar, a question and answer bar in your Zoom toolbar, because that way your friends and colleagues that are also on this call with you can use the thumbs up arrow instead of retyping the same question. So be thinking about formulating questions for our speakers as we're going through today's webinar. Put them in the Q&A function, and your friends can use the thumbs up if they have the same question as you. Closed captioning is available for everyone that needs it. Please use your Zoom toolbar for accessing closed captioning. And we know how important it is for individuals to get continuing education credits as part of this webinar series. Stay on till the end of the webinar, and the link for continuing education will be populated in the chat. And also the hope is as you exit the webinar room at the end of the hour, the link to the continuing education credits is also available for you. And don't worry if you miss it, you'll be able to get that continuing education link later on as well. And finally, this webinar is being recorded, and not everybody that registered was able to participate today. So you'll receive a recording of today's webinar that does include the slides and presentation after today's webinar. My name is David Shapiro. I am a white man in my late 40s. I have dark brown curly hair, a brown and gray beard, and gray glasses. I live in Denver, Colorado, and I am a person in recovery. And for me, what that means is I don't use cannabis, which I'm in recovery from cannabis use disorder, or alcohol, or any prescribed medications, except for those that are prescribed and in the way a doctor has prescribed them to me. A little bit about our program. HealthLinks is a public health outreach program. We shepherd and we champion health and safety at work. That's our goal, is to talk about supporting individuals in their workplace experience and looking at work from a systems design standpoint. And we do that through some tools and resources like our Healthy Workplace Assessment, all under the framework of the Total Worker Health approach, the integration of workplace health and safety. We're located at the Centers for Health, Work, and Environment, which is at the Colorado School of Public Health. And our offices are on the University of Colorado Anschutz Medical Campus in Aurora, Colorado. We always start with a land acknowledgement. It's been my honor and privilege to read this for the last 6 years on these webinars, and we'll start that today as well. As we gather, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems indigenous peoples have developed in relationship to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. And we respect the many diverse indigenous people still connected to this land. We honor them and thank the indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of all Native people. A quick disclaimer about today's conversation. We are going to be talking and sharing personal stories of substance use, of addiction. There will be conversations around mental health and co-occurring disorders. So we encourage you to engage with the content in a way that you see fit for yourself. And if anything comes up that's challenging and difficult for you, please know that around the country, 988 is a resource that you can text or call at any time. We're also available, to have email and other dialogues with you. So I just want to make sure everybody understands the views shared today are not necessarily those of HealthLinks, the Centers for Health Work and Environment, or the Colorado School of Public Health, and resources and support are available. You are not alone with whatever you're going through. Our agenda for today is we'll have a keynote presentation, a panel discussion, and then we'll conclude with hopefully 15 or 20 minutes for Q&A. So be thinking about those questions you have for our speakers and make sure that they get populated in the Q&A section of Zoom so that we can rank those and we can distribute them out when we do the Q&A section. Our goals are to review the essential components of what is workplace supported recovery or a recovery from the workplace, specifically within the healthcare sector, to explore how substance use disorder and substance misuse both is a risk and a hazard faced by individuals in healthcare, and also what supports are available for individuals. And then really hope that we can start to talk about stigma, how to raise awareness around the stigma and reduce stigma, specifically in the healthcare sector, around substance misuse, around addiction, around recovery, and promote healthy recovery for everyone in this space. With that, I'm going to introduce our keynote speaker for today, Dr. J.K. Costello. J.K. Develops population health plans for substance use disorder prevention, treatment, and recovery. Inspired by the ongoing explosion of substance use and overdose, he works across medicine, public health, and community organizations to create communities of recovery. His work covers all parts of the continuum from prevention and stigma to reduction to clinical workflows. He has extensive experience developing clinical programs for opioid use disorder treatment, having worked with more than a dozen clinics, syringe access programs, and jails. He has worked with numerous jails across the Colorado region on their medication programs for opioid use disorder and has advocated at the state legislature for better treatment in carceral facilities. As a physician in recovery himself, JK understands both the healthcare system and community recovery. But perhaps the most powerful work JK does is sharing his story of recovery as a person in recovery who has found his purpose in helping other people move towards behavioral health. So thanks so much, JK, for being here. I'm going to share my screen and move over to your presentation.
Awesome. Thanks, David. Thanks everyone for being here. My name's JK, as you said, and I have been in recovery since July 3rd, 2014. Next slide. I know you're all silently clapping. Thank you. So I really hold on to that date tight because it was the day before Independence Day. I had just gotten out of the hospital for pancreatitis. My parents had staged an intervention and essentially said that I could keep doing what I was doing, or I could be part of the family and go to treatment. And so for the second time in about a year, I went to treatment, and I'm really lucky that for me, that date of recovery means that I've been abstinent from substances ever since then. And I've always strived for something more in relationships and my work, and not settled ever since then. And that's what it means to be in recovery for me. But I hit rock bottom. I mean, I went to the hospital for pancreatitis. I lost some jobs, as you'll see in a few slides. I lost relationships with my family, did the kind of typical stealing my parents' car thing that you hear about on after school specials. So I think hitting rock bottom is a fair term for me. Lost my medical license, just lots and lots of bad things all piled up in those years before 2014. And so hitting rock bottom is really ingrained in my consciousness. And I do 12-step group. I hear a lot there and in the public that that had to happen to me, that I had to hit rock bottom, or I never would have gotten to where I am today. And it's really comforting, I think, for a long time, for about 10 years in recovery, it really comforted me that there was some fate that meant that I had to get to that point before I got into recovery, and that it was that rock bottom that really kept me in recovery, like being scared of substance use and all the bad things that happened. Really, really, it made me feel better that I hadn't actually wasted my life, but that I'd been making myself, like making my way to this inevitable bottom from which I could only recover. Next slide. Okay. But then I read this book about how there are all possible universes and there's like alternate universes and we exist there, but something different happened. And I started to think about there's a different J.K. Costello, and that should be in quotes, J.K. Costello, living out in another universe that has a different recovery day. And I thought, gosh, that's really profound. What if it was before I got pancreatitis? Like, how would I be different? Um, Yeah, that's pretty much it. It's just me speaking and my picture on the screen. That's about it. Sorry. The slides will get more exciting as they go on. Um, so what if I hadn't got pancreatitis, right? It cost a lot being in the hospital. I had recently lost a job. It certainly helped to bring my relationship with my loved ones and family to a new low. And I think that something different would happen, right? I would have been different. Who knows if it's better or worse? But if it were a couple weeks earlier, I wouldn't have had this physical health where I still worry about that, right? What am I going to get pancreatitis as I get older? Am I going to get pancreatic cancer? And so what would have been different? What could have changed that would have got me into recovery a couple of weeks earlier? Next slide. And finally, what if it had happened a few years earlier, before I had lost my license, before I had lost jobs, when I was really still kind of chugging along, as someone who had good friendships, had good relationships, had a good employment history, and what could have happened before that to bring me to this earlier conclusion to substance use? And I think about, my story, I'm really married to this, and it's hard to imagine that. But I think we could all imagine that there are people out there who may have had more protective factors, different friends, family, someone close to me talked to me about substance use in a way that resonated with me way before I hit rock bottom. And probably that would have been a family member, a friend, or coworker, someone I knew really well. And maybe that happened more than once. And it helped nudge me toward using less substances, using no substances, whatever it was, where I didn't have that same troublesome relationship with substances. And so I think when I started to think about it this way, that like I can hold on to my recovery date, but it's really untenable for me to hold on to the idea that everybody has to hit rock bottom before they recover. Because we know that preventative measures, people getting into recovery earlier, usually has better outcomes. Certainly, they're not going through as much treatment. They're not having negative, sometimes traumatizing experiences happening with their family. They're not losing jobs and having this bad work history. And so I started to think of myself a little differently, that this could have happened earlier, that I didn't really need to hit rock bottom. And for other folks with kids, that could have meant that their kids had more happy childhood memories. And there was just this like cascade of realization that if I had gotten into recovery earlier, things could have been different. They could have been better. They could have been worse. But multiplied over lots of people entering recovery earlier, or just general less use of substances, would probably result in better outcomes. And so public health for me is a story of listening to a story, hearing, telling my story, hearing other people's stories, but imagining something different. And so it's accepting that, this happened to me, no reason to rehash it, but it could be different for other people. And that what we do matters. And here, I think how we talk and act about substance use, specifically at work, really, really, really matters a lot. And so I've started thinking beyond this rock bottom paradigm to thinking about proactive work, intervention, conversations really about substance use. And I always think about what could have happened 2 years before, right? So, like, yeah, these bad things happen, but what if something happened 2 years before that? Next slide. And so when I started thinking about 2 years before my rock bottom, I had a lot more going for me. I had a good job, I had friends, I was engaged, my finances weren't a mess, and like I just realized that in that last year particularly, for me, my world got really, really small. The only people I had contact with really were people that worked at bars, drug dealers, some enforcement types, law enforcement, people enforcing licensure regulations. Even the positive folks, like the treatment professionals that I worked with, had some connection to enforcement. And so for me, everybody was scary in that field, even the people that were trying to help me. And there were very few positive interactions. There weren't really opportunities to share my feelings, to talk. It was really a pretty sad world. And I think that's what the nature of rock bottom is. It's pretty one-dimensional. But if I think back 2 years before that, 2012, even further before that, I had a lot going for me. And you can see all these realms, and this is kind of how I visualize my recovery now is through these 8 dimensions of wellness. And there are other dimensions of wellness. Some have 12, some have 9. I just choose 8 because somebody showed this to me when I was in treatment, and I thought it was a really, really holistic way to look at things. And in each of these realms, there are people that we trust, that we identify with in that realm and share with and hear from them. And so I started to think about, wow, how could this help us help people get into recovery earlier? And really, the nature of it is through talking, right? We talk with each other, express concern, and do so in a way that is understandable and empathetic and non-stigmatizing. And I realized like a lot of these do have to do with work. Obviously financial and occupational are very much job related, very much tied into our job, but even my intellectual life, a bit of my social life, and even a little bit of my environmental life is tied to my job, my occupation. And so I started to see work and obviously family and some of these other things like spiritual faith community as really, really ripe avenues to think about prevention and early recovery in substance use. Next slide. And so here's a semi-humorous walk through my substance use journey. Um, when I was 18, I was about to go to college and I thought I should get a job. And of course, I got a job at a pizza shop. And what did we do? We smoked weed all the time. And I learned about other drugs too. Learned about meth, which I never learned about before, that there are people there that use meth. And it was fun and games, and we drank and we smoked weed. But I for the first time, really started to intertwine work and substance use. And I don't mean to stereotype pizza shops, but there's a lot of different types of work where substance use and work, or at least after work, are really, really, really connected for folks. And so I started to think of like, oh, substance use isn't just a part-time thing, it's something I can do at work or after work. And then in 2003, I worked in a lab during the summer and I got in a fight with a coworker's husband, and it was all very substance related, and nobody said anything about it. And at the time, I thought, great, nobody said anything about it. But looking back, I think, why didn't somebody say something about that? Like, it's not acceptable in a workplace setting to get in a fight with your coworkers or with their loved ones because you're on alcohol. And that was certainly the case there. And then as that progressed, I got into my intern year after medical school, and I had a lot of conflict. I had a lot of missed days of work. I think a lot of these were very, very stereotypical symptoms of substance use in the workplace that nobody talked to me about. And I'm sure some people saw what was going on, but nobody mentioned it. And again, I really welcomed no one mentioning it at the time, but as I've thought back to what if something would have happened 2 years before, it made me realize that it's not totally normal. It's certainly not positive for us to ignore issues around substance use or mental health that are affecting people in the workplace. And then I left my intern year. I was really, really lonely. Intern years, you work really hard for low pay, and I didn't find my community. And part of that was because substance use was really my passion at that point, not doctoring. And so I left and I went to work at a bar and the census, which was a really cool combination of jobs because at the bar, I could drink, and working at the census, working from home, I could also drink. And so I really, really relatively thrived in this position until I lost both jobs at the same time for ironically drinking. And then the last stop on my work journey through substance use is here at the urgent care. And so I was a physician, I was practicing, I was using substances all day, every day. And I remember there was one day where they gave everyone drug tests at work, and I got really, really, really worried. But they stopped at the physician at the door to the physician's office. So all the nurses assistants, all the nurses, all the front desk staff got drug tested, and they didn't test me. And I was like, whoa, thank goodness. That would have been a disaster. And my only thinking was that like I would have tested positive for so many things. I could have just told them that it was a faulty drug test because they wouldn't believe that I tested positive for all those things. But they didn't. And it made me realize like, oh, people think physicians can't use drugs. That people were just like resistant to this idea that a physician, a healthcare professional could be using drugs. And so it gave me this like outsized, wrong idea of like, I'm above this, I'm bulletproof. But really, I was very, very lonely and really wish now that somebody would have talked to me way, 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 way back early in this timeline about the effect of substances in my life and also how they were affecting me at work. And you'll notice no work-related drama since 2013. Next slide. All right. So I've started to think more about what is there to do? Substance use, talking about substance use is really difficult. It's stigmatizing. Most people don't have a lot of tools to talk about it, and so we avoid it. And I've heard this story many, many times, especially from people in families where substance use is really prevalent, that they go to Thanksgiving and everybody gets really drunk and no one ever talks about it. And I did not have that experience personally. My family was not big in alcohol or drugs, but it seems to me that they find it easier to continue doing what they're doing versus talk about it. And I think that intervening or even just talking to somebody about substance use is the hardest thing. It's definitely easiest to let things go on, kind of put our heads down, bury our heads in the sand, and pretend it's not happening. But we know that we can help people when we talk about substance use. And here, I think one of the like what I've realized about adult prevention, which is what I've been thinking about, is that we don't really have it because we think about if somebody uses substances to the point it's problematic, they need to go to treatment and they need to see a professional. And that totally is true for many people that seeing a professional is very helpful. And in fact, one stigmatizing belief about substance use is that substance use treatment doesn't work. And we know that's not true. Like substance use treatment works quite well. And you see that over on the left side substance use treatment works about as well as treatment for other chronic conditions. And then on the bottom, you see specific to medications, medications really boost people's treatment for all different types of substances. And so it is a big myth that treatment doesn't work for substance use. But I also think that we kind of limit that, like, oh, if my friend needs help, then I have to go find a place for them to go to treatment. And that's not necessarily the case. If that's what they want, I think that can be helpful. But the idea of like packaging someone up, taking them out of their workplace and their community and sending them off to treatment, that doesn't always work. So sometimes community interventions are really helpful, and there's a lot of evidence for that. So over there, you see on the right, this one happens to be about 12-step groups, that there is a lot of evidence that they work. But I don't want to focus too much on 12-step because some people, that's not the thing for them. There are other groups like Colorado Arts and Recovery, like the Phoenix, where people can go and not work with a professional, but do something positive and be around other people who are not using substances, no matter how they identify. And that really hit home for me. I went to a Phoenix workout one time and I just assumed everybody had hit rock bottom and they were like in recovery. And I asked somebody next to me, I'm like, oh, what group do you go to? And she was like, I don't go to groups. And I asked her what's going on. She said, oh, I just don't drink. and she participated in that recovery community. And that was a real like mind-blowing experience to me. So, um, what I'd like to get across in the last couple of slides is that talking to people and doing things with them as a friend, as a coworker, can be really effective. And not just effective in a feel-good way, effective in a evidence-based, helping people use less substances, getting into recovery way. Hmm. Next slide. And so some of the myths that have been like thinking a lot about this and speaking a lot about it, and some of the myths that we come up against are people think that you have to be a trained professional to be caring and helpful. But really, um, we help people with things all the time. People give advice on relationships, help them through deaths of family members, and that's really, really, really beneficial. And you don't need to be trained as a clinician to speak with people on topics like mental health and substance use. And again, I'm not saying forego treatment. I'm saying that two can work in tandem and be even better than one alone, treatment or intervention, community intervention. And so there are trainings out there like mental health first aid that can help you speak more knowledgeably and in a way that's going to be more feasible and acceptable to people who are having mental health challenges. And substance use as well, right? There's a better way to talk about things using stigma-free language, asking questions, using motivational interviewing. All those things work, even if you're not a clinician. Second, people have to hit rock bottom before they'll accept help. I see a comment on this. We can determine our rock bottom. Yes. So I mean, yeah, rock bottom kind of becomes the point at which we hit recovery. But I think defining rock bottom as a point where somebody has lost a lot, sometimes everything, and really, really had physical or criminal justice consequences. Rock bottom could be a softer, earlier place. And we could call that rock bottom or not. And the truth is, people seek help at all stages. And usually, the earlier someone starts their recovery treatment journey, the better the outcomes are going to be. And I have a friend who got a DUI and never drank again. And that just like blew my mind because a DUI was not like a deep bottom to me, but for her, that was it. And then the last one is bringing it up might push them away. And I think this is the biggest challenge for most people that just talking about substance use may alienate their friend, coworker. But we know that conversations done right can actually bring people a lot closer. And next slide. I'll close by kind of personally dispelling that last myth because I was actually, it was on Facebook, I think, and I had been talking with a friend from college who I didn't keep up with that well and talking to him about my recovery journey. And we didn't really like connect or have continuous conversations. But one day he messaged me and he said, hey, okay, I had a kid, my wife and I had a kid. And I was like, oh, cool, congratulations. I didn't know that. And he said, and I haven't had a drink since 3 weeks before we had the kid. And you were part of that. And I didn't even know he had been thinking about not drinking or it was a problem in his life. And it showed me that like peer support, I'm not a peer recovery coach, but like a support from someone we know well can help us just as much as going to treatment. And so often that starts in the workplace. And so today, I think we're going to talk a little bit more about how workplace, not even interventions, but workplace actions and policies can help folks to enter recovery earlier or maintain their recovery. Thank you. David, you're on mute.
Thanks so much, JK. We really appreciate you sharing your story with us, the vulnerability and the honesty. I think that narrative about testing everyone in the hospital, but then pausing at the physician's door is really a really telling one and something that I think is interesting to explore, not only from a stigma standpoint, but how we have conversations. And, I want to mention in this too. We fully embrace SAMHSA's definition of recovery, that it is an individual process of change, that it's defined by the individual. And I appreciate that you mentioned harm reduction as well. This is Recovery Month. It is September, and there's a lot of conversation on my LinkedIn feed and in other places around the country. And it almost feels like there's some sort of debate or animosity between harm reduction crowd and recovery crowd. And Personally, I'm someone who wants to bring everyone together under the same tent, and I know each individual has different experiences. So if your recovery experience looks like harm reduction, that's okay for us. There's specific workplace policies we need to talk about that may work or may not in safety sensitive industries. But I just want to make sure that everybody understands we're trying to be as inclusive as possible with our definition of recovery. And from my standpoint, from the standpoint of our program, everybody really is welcome. And that's my hope that we are able to create those kind of environments. With that, I'm going to introduce our second speaker of today, Dr. Bill Hamill. Dr. Hamill is a member of the Illinois State Dental Society Foundation Board of Directors and chairman of the Dentist Support Program Committee. He received his DDS degree from the University of Illinois, Chicago in 1983 and has been a general dentist in private practice since his graduation. In 2022, Dr. Hamill was asked to serve in the inaugural cohort of the American Dental Association's Wellness Ambassador Program. He has given presentations about substance misuse since 2011 to districts and also at national meetings and dental schools in the US and Canada. His personal journey with substance misuse provides him with a profound and unique perspective, enriching his presentations and enabling him to connect deeply with his audience on this critical issue. So, Dr. Hamill, thanks so much for joining us today. We're eager to hear your story and hear about recovery in dentistry. Just one note, if you have questions, please make sure to put those in the Q&A for all of our participants today. With that, Bill, I'll turn it over to you.
Thank you, David. It's a pleasure to be here. It's an honor to be here, and it's great to hear JK speak. Um, as you said, I've been in practice now for 42 years, and my story started back in 2010, or I'm sorry, back in 2001. My clean date is August 26th of 2001, and prior to that, I used Vicodin for about 10 years, and it really brought me down, but I was very fortunate not to have lost my license or had any trouble with the state board. And so I was able to continue to practice and continue on after treatment. Um, I have three children. I'm currently practicing with my middle son, Philip. He's been with me since 2018. But my oldest son, Bill the fourth, is a recovering heroin addict. And I am a big proponent of harm reduction because methadone saved his life. And he is in recovery now and has a great job and is married. And I'm grateful for that. Um, I said I'm the chairman of the Illinois State Dental Society Dentist Support Program. And our goal is to help dentists and dental staff who are in trouble. And we're merely a resource for people. We don't send anybody to treatment. We are just there to provide guidance and help people find recovery. And um, it has been my pleasure to do this for the last 10 years. And it is, like you said, everybody's recovery is different. And what we find is that, some people will respond and do the right thing and go into treatment. Others, it just takes a lot longer for them to find their way. And being open and having the ability for people to call us and talk about these things, it's helpful when someone can speak to a colleague. Um, the American Dental Association has started this, as you said, a wellness ambassador program, and unfortunately, dentistry has been way behind medicine when it comes to recognizing the need for health and wellness education and resources. So the American Dental Association started the Wellness Ambassador Program, and the goals were to raise awareness about the dental profession challenges. Dentistry is extremely stressful. Um, they want to ensure that the state and local dental associations have resources available to their members, and they want to try to connect people to get the help that they need. And one wonderful thing that's happened is the American Dental Association has partnered with the Federation of State Physicians Health Programs, and they have provided guidance to the ADA on getting a program up and running that can be helpful for dentists. So it's about time that dentistry got with the program and started doing this for dentistry. It's been long overlooked. Contrary to popular opinion, dentists do not have the highest suicide rate. That is the preview of construction workers. But dentistry does have a much higher suicide rate than the average U.S. citizen. So it's good that the American Dental Association has started to recognize these things. I'm also grateful to be here because one of the things I do as part of my program is I travel the state of Illinois with a PowerPoint and I tell my story. I talk about addiction. I try to give some education to dental students and to dentists about the realities of addictions and substance use disorder in dentistry. And it's been very helpful to my recovery to be able to do that, but also it's been wonderful to be able to do that and give back. The dental associations are starting to provide some forms of counseling with BetterHelp and TalkSpace. The American Dental Association just recently offered TalkSpace as a benefit for people who are struggling. And some of the state dental societies are doing the same. That remains to be seen how helpful that will be, but at least there's something being done in that regard. The stresses of dentistry are many, but the big things right now are student debt, staff shortages, jobs that people have at large offices where there's just an emphasis on production. Insurance and reimbursements can be very low, so pay can be low sometimes from what you would expect a dentist to be. And just the general stress, as they say, of working on a car with the engine running. It's a profession that I'm fortunate that I love what I do and I've been able to do it for this long. But for many dentists out there, it is definitely stressful, and many do turn to substance use. And we're just trying to provide a way for them to get the help that they need. So that's all I've got. Thank you for having me here, and look forward to answering any questions.
Thanks so much, Bill. Again, we really appreciate the honesty, the transparency, and the vulnerability of you sharing your story. It's really powerful to be on this webinar with you and with JK, and now we're going to hear from Kristen as well, leaders in the fields of medicine, and sharing your story, being vulnerable and transparent. We're really hoping more and more individuals feel comfortable stepping up. I mean, clearly you all have had some experience telling your story. And again, I'm starting to see a few questions come into Q&A. And so if you're thinking about things, and one thing that often comes up in conversations that I have in the workplace is, some of the things we should consider around disclosure. And maybe that might be a place to start when we get into Q&A. If someone's thinking about speaking up, how they might frame that, especially in the healthcare sector. With that, I'm going to introduce my friend and colleague, Kristen. With over 3 decades of nursing experience, Kristen has firsthand knowledge of the difficulties faced by nurses. Having personally experienced the challenges of mental health and substance use, she found recovery in 2005. Kristen has created a lifeline for nurses seeking support and understanding by founding YSPAN, which is the Wisconsin Peer Alliance for Nurses, providing a safe space for nurses to find support, share experience, and build resilience. She published a book called An Unlikely Addict, which is her story of recovery, and a textbook called Substance Use Disorder in Healthcare Professionals. Kristen is a certified addictions registered nurse, or CARN, and a certified professional recovery coach, or CPRC. Kristen, thanks for joining us today. We're eager to hear your story as well.
Thank you. Thank you, David. Hi, everybody. My name is Kristen Waite-Labatt. So grateful to be here today. I really appreciate the invite. My story. So I have been a Wisconsin nurse for 34 years, which is hard to believe. I saw a couple people from Wisconsin in the introduction, so that's awesome to see. Nice to have some Wisconsinites here. And I've been in recovery, as David said, since 2005. So this January, I celebrated 20 years of recovery, which is also hard to believe. I was discovered diverting fentanyl from the hospital I was working for back in 2004. I lost my job. I lost my nursing license. I was arrested and ended up spending about 4 months incarcerated. I did not like jail. I never want to go back there again. And I really made a commitment to myself that when I got out of there, I was going to do whatever I needed to do to be in recovery. And thankfully, that has been the case for the last 20 years. My substance use did not start with drug diversion. In fact, it started many years ago when I was a teenager struggling with anxiety and depression, unable to name those, having no idea what that was or if it was something I should, like, it was just the way life was. It didn't occur to me I should do anything about it. I went to college and I discovered alcohol. Alcohol made me feel a heck of a lot better. I thought I had found the answer to all of my problems. Took me 6 years to finish my 4-year nursing degree because of my alcohol use, but I did finish and began my nursing career. I drank periodically. I was a binge drinker. So for the next number of years, my life was status quo. It just kind of went along. I drank periodically, but always at home and after my daughter went to bed. I had myself convinced it wasn't a big deal because I was not going out and partying. I was being a good mom and staying home. And in the late 90s, I had surgery and I was prescribed Percocet. I loved that Percocet. And what I liked about it is that it gave me the same type of relief that alcohol did, but it wasn't messy like alcohol was. I wasn't stumbling around or acting goofy. I didn't smell bad. I wasn't waking up with hangovers. So that was very appealing to me. And I found more ways in the next couple of years to get pills. I was working in an emergency department, and a couple of years after first having that Percocet, it occurred to me that we throw away a lot of really good drugs. And so after a case one night, I put what I had left over in my pocket instead of wasting it the way we're supposed to do. And I took it home and I took it IV and had that same kind of revelation as I did with Percocet and with alcohol. Wow, that makes me feel better. But it was immediate and stronger. And that was very appealing to me. So pretty much every leftover medication I had after that point, I took home. Really not giving any thought to what I was actually doing or the consequences of that. It just made me feel better. And so I didn't even think about anything else. Well, one day I had leftover fentanyl after a case. And that drug was very different than the others. Much like the others, I had an immediate, wow, that makes me feel better. But it was so much stronger, that so much more intense. It made me feel nothing. I was going through a divorce at the time, so that really made all of that go away. The other thing that fentanyl did was caused a craving like I had never had before. It was after that that I started stealing it from stock. And it doesn't take them long to figure out what's going on when you do that. So that's when my diversion was discovered and pretty much lost everything. Or so I thought. So I've spent the last 20 years now kind of rebuilding my life and my career. I spent the early part of my recovery figuring out how to take care of myself, how to put myself first. That was a foreign concept to me. I was really good at taking care of other people, but paid no attention to my own needs. And as the result, spent a lot of time struggling. So I've put a lot of effort into figuring out how to put me first. What is it that I need? And how do I do that? It takes a lot of practice. I still practice that today. I work on my recovery every day. Fast forward a couple of years, I found out that some other states have really cool peer support programs for nurses going through what I did. Back in 2007, I had decided to try and get my nursing license back, and I joined a monitoring program and did receive a restricted license. I was so excited. to be able to work as a nurse again, because I really thought that was gone forever. And joined this monitoring program. It's a 5-year program here in Wisconsin. It's overwhelming and scary, but a lot of gratitude went along with that. I graduated from that program and I have my full licensure back today. Yay. But it was hard. And when I realized that other states have peer support programs for nurses going through that stuff, I thought, boy, we really need that in Wisconsin. So in 2021, we started WISPAN, or Wisconsin Peer Alliance for Nurses. The numbers are over there. Our contact information is there. To be that support for nurses going through what we did. It's our 4th birthday this month. September is the month that we started. And it has been the most meaningful thing that I have done in my recovery, in my life, really. Last year, we realized we were missing something. There are nurses all over this country that are struggling, in particular since COVID, but really have always been. And we really wanted to provide a space for those nurses as well, those nurses so that they had a place to go. Because we really thought maybe we could intervene for nurses before their substance use is affecting their practice, maybe before their mental health is leading them to substance use. So kind of backtracking, just like JK was talking about, and how can we intervene earlier to help nurses, period, like not just once they become, once they have a problem. And so we launched that last year in January, and that's been absolutely wonderful and really well received. The last thing I will say is that we started a national program called the National Association of Peer Support for Nurses, or NAPSN. That's the bottom link up there. And hoping to be a central place for resources for nurses in peer support. Knowing that we don't have a lot of those resources yet, we've created a resource list. So it's on that webpage of not just peer support resources for nurses, but general support resources. And so you can go there, find your state, and click on a link. We're also in the process of developing a toolkit of how to start a peer support program. So whether that be for states or organizations, able to provide that resource, share the knowledge that we've gained while starting programs to help others. So I'll pause there. Thank you again for having me here today, and open to any questions you may have. Also reach out to contact us if you have any questions that we don't get to today. Thank you.
Kristen, thank you so much for sharing. Every time I hear your story or reread your book, I'm just really so grateful to know you and for your strength and your courage of sharing your story. It is an amazing story, and it's one that is probably more common than we talk about. And I think that's part of what we wanted to do here today, is put some faces on what the face of recovery looks like and feels like, right? I'm someone in recovery from cannabis use disorder. For me, it was a 30-year experience with cannabis that ultimately I decided I couldn't use marijuana anymore and lead a life that was authentic and that was honest for myself and for my family. People don't talk about it as much as they could. And I think that's where I want to start with questions. JK, if you can come off mute and back on camera as well, this will be the Q&A section. And Bill, I think I want to start this question with you. There's only one question in the Q&A, and if there's others, I really want you to encourage you to put it in there. This comes up a lot from folks, and I bet you that there's people on this webinar today. If there's a couple hundred people here, there's someone on the webinar, or someone who's thinking about reaching out and asking for help or support, which is something I really hope you do. But Bill, do you tutor or do you mentor any colleagues about, hey, I'm thinking about bringing something up that I need some help or support? I'm thinking about disclosing. Any recommendations for how someone should start that conversation, where they should start, some things that they should think about? I mean, the word in the chat, in the Q&A, is, should we be worried about confidentiality? And I think that's something I want to ask all three of you, especially in the healthcare space, is just some tips for people that are maybe thinking about dipping their toe in the water of disclosure, and maybe some things to think about as they start, because I think that would help a lot of people on today's webinar, and for people that we know as well. So.
Well, I'd say that the number one thing most dentists fear is a call from the state board, and they're always thinking that if they call us, that could happen. And that is one of the things we strive very hard to make it clear, that calling a peer support program in no way will jeopardize your license, because we are bound by confidentiality, and we want somebody to get in recovery and get back to work. We do not want people to be taken out of the workforce. And most dental boards today recognize the importance of keeping dentists working. It just costs, and it costs more time, money, and aggravation to take a license away and then try to reinstate it. It's much easier if people know they have a safe place to go. And most states now are much more friendly to people who are honestly trying to get into recovery and do the right thing.
Thanks, Bill. JK, I'll have you come next, and Kristen, I want you to chime in as well. Disclosure here, right? What are some thoughts about bringing this up in the workplace? JK, you have some thoughts?
Yeah, I mean, Bill, that's great to hear, because I can tell you I went through treatment with a lot of physicians, some of whom self-disclosed to the board, and frankly, all of them regretted it. And so I wish, I don't know what states they're from, but I think all of them wish there had been a place where they could go and seek support without disclosing to the board, because um, despite the board's best efforts to be compassionate, I think it did not end up that way for those folks. And I know physician health programs, and I hope dental health programs have come a long way in understanding addiction, medications, but that was really kind of shocking that like they did what they were supposed to do and later ended up having a lot of consequences. Um, so, disclosure in a formal way, I think that obviously it's got to be done really carefully, no matter what field you're in, right? Healthcare or something else, because I still, not practicing anymore, still have times when I disclose and I think I shouldn't have told that person. So I generally go with my gut, like, how am I feeling about this person? Do I feel trusting in them? Should I talk to them about this? And sometimes I just leave it surface level and say, I work in substance use, and I don't give them the whole backstory. So I think that's a kind of a good rule of thumb. Like, if it doesn't feel right, don't do it. Because I have had a couple times where it came back to burn me, where I felt like I was still being punished or stigmatized um, for long, distant, remote prior substance use.
Thanks, JK. So a couple things I heard so far before I turn it over to you, Kristen, for some suggestions. One, check out if your state or your organization has a peer support program. Those are confidential. Another one is trust your gut, which can be really hard to do if you're actively using substances, even intermittently, because your gut is going to tell you a whole bunch of stuff that may or may not be true. But trust your instincts, trust your gut. And the other thing I've been talking a lot about in higher ed and in healthcare is, maybe a first step is seeing if your employer has an ADA, an Americans with Disabilities Act coordinator. My understanding of Americans with Disabilities Act professionals and coordinators is they receive training on how to handle these situations and disclosure, and they are not necessarily in the human resource or management trajectory. And so I encourage folks to look at ADA compliance officers, just ADA in general, because if you decide to disclose and you're able to reduce or no longer use alcohol or other psychoactive substances, you're covered under the ADA, not while actively using substances, but in recovery. And so ADA officers are trained, have training on how to have this conversation. So it's another group of professionals I want to engage in this conversation I've been recommending. And the last thing I tell people in this scenario is, if you're really hesitant about talking about yourself, you can always do what many of us have done before and say, I have a friend I'm reaching out for, and I'm just trying to figure out what the process is in order to help my friend, right? And so you don't have to self-disclose either. You can find out a little bit more about the place you work, about what type of supports your state has available by just saying you're in a peer role, whether or not it's true, and you're reaching out on behalf of a friend. Kristen, anything you want to share about disclosure? I keep hearing from hospitals and nursing associations, we want to hear before it gets to the point of your story. We want to know, we want to have the conversation, we want to be preventive or harm reductionist, but ultimately what ends up happening is, the diversion or the offense or the car accident or whatever it is. And how do we start to get more people to feel comfortable speaking up, in your mind?
I think the reason for that is stigma. It's too scary, especially when you are in healthcare. I mean, I can only speak for myself and nursing, really. That's my experience. It's really hard when you're a nurse and you know that reporting what's going on is going to result in licensure, restrictions and a lot of difficulties. So it's hard. What we can do about that is get help sooner. And I think by those of us who have been in recovery for a while, sharing our stories and letting folks know that this is a problem, but there is help out there, got to get connected with someone in recovery. Peer support programs, I think, are the number one way when you're able to talk to another person who's been through similar experiences, the shame and stigma go out the window and you're able to talk more openly. In Wisconsin, our WISPAN meetings are open to anyone in any state, so folks can reach out to us and join our meetings. I think it really depends on where you're at in your recovery with who you share that information with. So I obviously share very openly at this point in my life. It's probably not the best idea for someone who's still working on their recovery to go on a webinar and share so openly. So I like the trust your gut. And I also agree with you that if you're still using, though, your gut might not be giving you the right information. So trust somebody else in recovery.
Thanks, Kristen. I appreciate that. We're probably not going to get to, I see all the questions coming in, and we're probably not going to get to all the questions in the last few minutes here of the webinar. So we're talking about people feeling more comfortable disclosing. JK, I'm wondering if you have any thoughts about, as a manager or supervisor, what's one thing, or as an organization, what's one thing you want to recommend to individuals to be supportive in this scenario, right? The hope is the organization is not completely zero tolerance, and we work with a lot of organizations on shifting from zero tolerance to more recovery, workplace supported recovery. But with the couple minutes we have left, I think I'll ask each of the three of you. Okay, we're talking about disclosing from the end of the person in recovery. We shared with an HR manager, we shared with our own supervisor, maybe we shared with the leader of a company. JK, what's something that individuals hearing this issue should think about or consider in that situation or that scenario, do you think?
Sure. Yeah, a couple of things. A lot of places have to be, if you're a federal grant recipient, you need to be a drug-free workplace. We really took a hard look at what does that mean? What are the legal aspects of that? And tried to understand how we could also be recovery friendly and still meet. We're literally legally bound to be a drug-free workplace as defined by the federal government. And so I think we did the best we could navigating that, because it doesn't just mean that like you have to fire people if they use drugs. The other thing is I put something in the typed responses of principles of motivational interviewing. Like almost everybody, at least everybody in a supervisory HR role should know those, because what happened to me in my personal experience, and also my tendency is to wait until things get to a point and then blow up and use a lot of words that aren't going to help, like alcoholic. And so motivational interviewing, and preferably used early, asks open-ended questions, helps with affirmations about what positive behaviors people have made, and also does leave open, if somebody doesn't want to talk about it, that you can state your experience. You missed work the other day, without calling them an alcoholic. And so those are a couple of the things I've used as an employer to think about how can we be a more compassionate workplace while still maintaining, reasonable boundaries and our obligations under the law.
Yeah, thank you. And we're going to follow up with some resources as well. I agree. Objectivity is really key here, right? And, stating what you've seen objectively, right? So unless you saw someone injecting a substance or smoking or vaping cannabis, you actually don't have the objective fact that happened, but you didn't show up for work or you were stumbling, etc. And so stating the objective fact, I think, is important in this situation as well. Just with a minute or so left, I know it's not a lot of time. Kristen, any thoughts about how you would respond in a leadership role when someone's sharing? I know you're in peer support, so my guess is you're pretty compassionate. But from an organizational standpoint, what's a couple things you want somebody to think about?
To maintain that compassionate approach. Remember that recovery is possible. You don't have to fire everybody. And make sure that no matter what, whether you're able to keep them employed or not, that you offer them resources so that no matter what happens, they have places that they can go to get support and be safe.
Great. Thanks, Kristen. Bill, anything you want to add from a manager or business owner standpoint of what you want people to think about when someone shares?
Yeah, if they're in a role that puts patients in harm's way, you have to sometimes make tough decisions and take them out of that role. But if people are willing to do the right thing, they can do that voluntarily and then get themselves clean and sober and get back to work.
Thanks for mentioning safety sensitive situations are really challenging. Patient handling and care is really challenging. Support is available. I think that's the message that I want to leave everybody with today. We're trying to shed a light on something that a lot of people don't talk about by being open and transparent, by letting you know if you or a friend, a family member, a colleague is experiencing something that's challenging. There's a lot of people that want to help and support. And so it does take some courage to come forward and talk about it. And it does take the vulnerability and willingness to do so. And things can be hard and they can be scary. But the main message I want to get across today is there is hope. Recovery is possible. You are not alone. And there's a big community of people that are ready to help and support you whenever you or your friends or colleagues are ready. Our next webinar is in November, November 19th. We're going to be talking about a related issue, chronic health conditions in the workplace and how to support individuals with other chronic health conditions, cardiovascular disease, type 2 diabetes, even cancer. Click on the link for the continuing education credits and provide us feedback. That link should auto-populate when you leave today's webinar as well. I hope everyone has a successful and a positive recovery month. The status of the world is challenging for so many right now. And so take care of yourself, take care of your friends and family members, and so much gratitude for JK, for Kristen, and for Bill for sharing and being so open and transparent and vulnerable with your stories today. So thank you for joining us. Let's hope for recovery-friendly workplaces throughout healthcare this year and in years to come. Thanks, everyone.